This is the hair that I ordered from Amazon, and it just hasn't come yet. So I'm gonna go get it real quick. Morning. It's overcast, but it's not too cold. I mean, it's just a great time to go out for a run. I have a very, very special guest with me today. This is Dr. Gary Landsberg, one of the preeminent pioneering animal behaviorists in the world. I have known this man for 20 years. I've looked up to him. He's taught me everything I know. Gary, thank you so much for being here.
You're welcome. Glad to be here.
Give our viewers like the top couple of tips that you want them to know about how to make going to the vet more pleasurable.
Well, I think with any behavior problem, we're talking about fear, anxiety, and stress. It's the cases I see every day in practice. My aggressive cases. It's not dominance. It's not owners being leaders. It's not cats who are abnormal. We're talking about fear, anxiety, and stress. And one of the big ones is coming to the veterinary clinic, where many owners don't want to come, are afraid to come, because their pets don't want to come or are afraid to come, and that doesn't need to be the case anymore.
Right. It sets up a vicious cycle. So the pet owner fears going to the vet because they think that their dog or cat's going to react negatively or be afraid, and so they create stress and anxiety. The pet feeds off the stress and anxiety, and the circle continues to go.
So if we want to change clients' attitudes, and more importantly, or as importantly, the pet's feeling about the visit, it starts at home. One thing you can do, which leads all the way through the visit, is considering fasting the pet and bringing its absolute favorite treats along with you, and at the veterinarian's perspective, having a smorgasbord of treats available to appeal to that pet. So carrier train your cat. Cats love jumping into boxes and crates. You open a box and what happens? I mean,
they jump in.
Yeah.
Right.
But they won't go in their carrier because you put them in. You open a carrier, you put some treats in there, you put some toys in there, you put some bedding in there, maybe some pheromones. There you go, the pet's into the carrier. Take it to the veterinary clinic. Take it for some car rides with good outings to visit some friends, neighbors, relatives, and back home again, especially dogs, where you can go play in the park, not just to the veterinary clinic. When they come in, get them settled down, some treats from the staff, some treats from the veterinarian. When they come into the examining room, don't drag them in. There are dogs who, if you throw treats in front of them, will run in to get the treats. Right. We have animals who you put on the scale, guess what happens the next time? You don't want to go anywhere near that scale. You throw some treats on the scale, or you have a little treat dispensers above on the shelf above the scale, and when the pets come in the next time, they run on the scale and sit there going, where's my treat? It's about attitude, it's about preparation, and perhaps even more important than everything I said as a parameter here is start early. Start with their first visit. Start when they're young so that you're being preventive and proactive. If the pet is stressed, I had an MRI a few weeks ago. Nothing's wrong, and don't worry about that. But have an MRI. But I'd had them before, and I don't want to go into that thing. Confinement, stress, anxiety. A little bit of a benzodiazepine, and I think I'll have one next time. I don't think I have a problem with that. I was fairly relaxed. Why should we go through the stressor? It will help us for the next time to be less stressed. And if they're really stressed, wouldn't you want to have sedation for your scoping instead of staying awake and remembering that whole thing? So the bottom line for veterinarians is, at one end, be proactive, use lots of treats, design a hospital that's right for the pet to be positive owners, positive vets, positive outcomes, and at the other end, when they become fearful and anxious, think about medication.
That is great advice from the guy who literally wrote the book. Gary, again, thank you for all you do for our profession. You have touched my life in so many ways. You know this. I mean, we've worked together for so many years, but I got to tell you, there's nobody quite like this guy. He is so committed to helping dogs and cats and people live more meaningful, stress-free lives. So
thanks to you for doing this.
Thank you. He is with the government. But don't tell anybody because he's probably here like on a spy mission.
Hi, I'm Tasha McNerney. I'm a certified veterinary technician, certified veterinary pain practitioner, and a VTS in anesthesia and analgesia. I work at the Route Animal Hospital in Glenside, Pennsylvania, and also at the Center for Animal Referral and Emergency Services in Levittown, Pennsylvania. And I'm here speaking at CVC on anesthesia and pain management topics.
In other words, she is a veterinary nurse rock star. So Tasha, you are talking about something that I hold very near and dear to my heart, and that is pain management.
Yes.
Don't let your babies hurt.
Yes.
So tell us a little bit about what you're talking about here and how pet owners that are watching this could benefit.
So at CVC, I'm talking about ways that technicians can incorporate better pain management into their practices and how we can educate clients on ways and signs to recognize in their pets to make sure their pets are pain-free. Especially in the post-operative period, we want to make sure that pets are going home pain-free and then maintaining that pain-free and getting good physical rehabilitation, especially if they had orthopedic procedures. And we want to talk to clients about ways that they can recognize pain in their pets. You know, if they stop eating, if they're not moving around as much, if their cat's not jumping up onto the counter, they don't want to do stairs, they won't come up to bed as often as they used to, and their activity level is decreased, then are we dealing with chronic pain in that sense? You know, these dogs with osteoarthritis, we don't want them to hurt. We want them to have a good quality of life. So talking with clients and educating them on signs to look for and then ways we can make their quality of life better and pain-free.
And Tasha, you are singing to me because it is about quality of life.
Yes.
I mean, pain diminishes an animal's quality of life, and nobody should have that. I mean, it's our responsibility as pet stewards to make them comfortable and happy. So you mentioned some good tips on how you can identify pain. What are some of the cool things that we're doing to help ameliorate or reduce pain?
Managing chronically painful older dogs and especially older cats, I think that that's really important because we can give them a longer quality of life. And there are so many new, not only analgesic and drug therapeutic options that we have, but also physical therapy options that we have, acupuncture that we have, laser therapy.
Class 4 laser.
Yeah. Massage therapy, hydrotherapy, weight management to help reduce the inflammation and the pressure on their joints. So there's so many different things. It doesn't have to be just drugs. We want to use the drugs together with the physical therapy to do a multimodal approach to give them a better quality of life.
The one thing I think that sometimes veterinarians, veterinary nurses, even pet owners get wrong is they think, oh, it's the one thing that's going to help. And it's usually a lot of things. Like we're having to do combination therapies.
Yes, it's not just I'm going to give them a pill and then they're going to go up the stairs and they're going to run like they used to. Now, certainly non-steroidal anti-inflammatories are amazing, but we really want to use non-steroidal anti-inflammatories together with physical therapy modalities to give them a better quality of life. That's why things like hydrotherapy are so important, massage therapy, passive range of motion. And these are things that we can teach the clients how to do. We can teach them how to do passive range of motion at home. We can teach them how to do some physical therapy exercises at home. It doesn't have to be, again, all drug therapy. We need to use all of them together to get the best multimodal experience for that patient.
Dog person, cat person.
Well, as my shirt will say, I'm clearly a brachycephalic dog person. I have a cat, but I am a dog person. Yeah, definitely.
And you notice how she said that? I have a cat. No.
I mean, he's great, but the dog is my, he's my love.
I'm going to tell your cat. I'm personally.
Yeah, I know, Darwin. Sorry, Darwin.
Veterinary technician versus veterinary nurse.
I love veterinary nurse. I think it gives a clearer definition of what we do to the public. I think that sometimes we still have a hard time explaining to the public what a veterinary technician is. Are we working just technically? Are we working with the blood analyzers? Are we working with just the anesthesia machines? I think when you say nursing and you talk about nursing care and ICU care and just all of the things that we do within our job, like nursing care really is the most all-encompassing. And I think we need to provide a united front and be veterinary nurses like they have in other countries and kind of come together as a profession to say that we are veterinary nurses. We're going to provide amazing, awesome care, everything from physical rehabilitation to giving a rabies vaccine to doing amazing anesthesia to dentistry, etc. But it's all going to fall under veterinary nursing.
Why did you become a veterinary technician / veterinary nurse?
I really enjoy providing a good experience for the pet. I want to take a pet that's potentially painful and turn their life around.
Well, you can see why she is so powerful. We are so lucky to have people like Tasha in our profession. Thank you so much for all you do.
No problem.
And thanks for coming out here and sharing your knowledge and passion with CVC San Diego.
Yes, go CVC.
Woohoo. Bye-bye. It's now after lunch, late in the day. I've got 3 more hours of lectures, and that's it. It's been a really good but full day. A lot of fun. Got to catch up with some friends, and tonight we've got some pretty exciting meetings. So all in all, it's been a great CVC.